Hello, my name is Abdalla Zarroug. I'm a pediatric surgeon at the Mayo Clinic in Rochester, Minnesota. And today we're going to be talking about adolescent bariatric surgery. And for the most part, there are three procedures that are done for adolescent bariatric surgery. The first is probably the most well-studied. It's the roux-en-y gastric bypass. We do this laparoscopically. And that's been the most studied in adults and in adolescents as well. It probably has the most significant weight loss and probably has the most significant change for the medical comorbidities because it has the most significant weight loss as well. So that's an option that we perform. We have performed it in the past successfully. And should we decide that that's the best thing to do, then we'll go ahead and perform that procedure. There are other alternatives. One is the laparoscopic adjustable gastric band. It's something that has been reasonably well studied. There is a randomized controlled study out of Australia that has performed these procedures in adolescents with reasonably good weight loss. There are, however, a significant number, about a third, that do need revision surgery or some kind of surgery or intervention once the band is in place. That's something that we reserve as an alternative. They need to live close to us so that we can do the adjustments. The bands can be expanded or deflated depending on how things are going. And they do need to have close follow-up in order for that to be successful. Oftentimes we require them to come in once a month, so that's something that also needs to get negotiated with the family. And then the third procedure, which is an emerging procedure, is called the laparoscopic sleeve gastrectomy. Here at Mayo Clinic, actually, we're the first to publish on that procedure in an adolescent in the United States. And there are others in the Middle East that have performed the procedure more extensively. More recently, there's been a very good study out of Saudi Arabia that has shown reasonably good weight loss and resolution of medical comorbidities, but it's clearly the least well studied out of all the procedures. However, I think that it remains a very good option. And basically what we do is we meet the patient, we talk to the family, and we decide what the best thing is for that individual patient. And we do that individually, and we do that as a group. So the pediatric endocrinologist meets with the patient. They see the dietitian, they see the psychologist, they see us, and then we all get together and decide, well, we think that this is the best thing for the patient. They meet criteria. Let's go ahead and put them through the 6-month program, and then they go ahead and perform the steps that are necessary in order to be medically fit. They'll hopefully lose some weight. They'll be a medically fit and psychologically fit candidate. And then thereafter, when we meet again, we go ahead and perform the procedure. Really, the procedure, maybe because we're surgeons, is one of the easier aspects of the entire program. We are very confident in the techniques that we're using. Again, the bariatric surgeon, the adult bariatric surgeon, performs these procedures routinely for him or for her. So the procedure itself, for us, is probably one of the most straightforward aspects of the entire process. Really, the adult surgeon, the adult bariatric surgeon does these routinely. We perform, or I perform, laparoscopic surgery on a routine basis as well. Thereafter, once they leave the hospital, they get instructions again from the dietitians and from us. We meet them with them regularly to make sure that everything is going well. And that's when the weight loss ensues. For the most part, the medical comorbidities, for example, the diabetes or the sleep apnea or whatever the indication was, we've had extremely good results with the patients that we've had, and the literature would support that with weight loss, these medical comorbidities do resolve quite rapidly.